Listening to podcasts is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Hey guys, welcome to another episode of Civilian Medical Podcast. Just as my dog comes in, perfect timing. So this is episode 82. My name is Dietrich, Skinny Medic on YouTube. Got my good friend Bobby Wells. Doesn't have a cool name on social media. We got to get some kind of like jujitsu blue belt medic or something for you.
I've so far resisted adding BJJ to my my Instagram handle. So far, it's just R Stanton TX.
I thought when you get your blue belt, you're supposed to automatically do that to your like Instagram.
I think you're supposed to, but I've resisted that so far. I also resisted the urge to take a break from jiu-jitsu for a year once you get your blue belt. I've been pretty steady. And in fact, recently, because I'm doing a camp this summer where I'm anticipating doing about 30 hours of BJJ in a week. Not a sponsor, but Origin Camp in Maine, Origin Immersion Jiu-Jitsu Camp.
Hey, but if they want to sponsor us,
they want to sponsor us. I'm even wearing the shirt right now, so Origin hoodie. I figured I need to bump up the amount of training I've been doing. So I've been doing about 7 to 8 hours of training a week the last few weeks. I'm competing on Saturday, so this week I did 4 classes and called it quits. So I'm taking a rest day today.
That's awesome. I'm a slacker. I go like 2 nights a week, so 3 hours a week of training. So
do what you can.
Yeah, I was hitting it pretty hard there until I got my blue belt, and I did slack off a little bit. Like once I got my blue belt, I was like I did get the blue belt blues, but I'm kind of like, all right, I made it. Like I'm a blue belt. But then like I can go in there, I can smash the white belts for the most part. Like, all right, this is great, and then get smashed by the purple belts and black belts like that. So like, this is kind of it. So I usually go 2 nights a week, but 3 nights a week try to. And then Gage is competing this weekend. So, well, he's supposed to. He is 2-stripe white belt. So, but he doesn't have anybody in his weight division. So he's either going to have to go up by 20 pounds or see what happens there. So I don't know. So he's going to try to compete. So I'll go be a cheerleader for him.
Yeah. I think it's more nerve-wracking being a parent watching your kids compete than it is competing myself.
Oh my God. Yeah, I have not competed, but it was very nerve-wracking like the last time just watching him. Like I know what he can do. I know what he's capable of doing. Just watching him like, oh my gosh. So yeah, definitely stressful. So this episode, we're going to talk about civil unrest. I know that's kind of a big, broad term, but we kind of talked about it in the last episode back in January that Michigan was going on. Minnesota. Okay, sorry, you're right. But now, like we've had a couple little things pop off. Texas, Old Dominion College. So lots of things to talk about. Of course, everything going on with Iran, and we were talking about before we started recording possible sleeper cells, or even people who kind of lean that way. We always have to be like your head. You got to be aware of what's going on. Like you can't just like walk through your head in the clouds.
Mm-hmm. Absolutely. I think what gets people is there's this idea in our heads. It's a peer pressure that doesn't even exist, but we feel like culturally it's inappropriate to call something out that seems abnormal. And you see this all the time. There's a lot of social experiments that have been done and videos posted on social media where there's a kid walking on the sidewalk, and as a stranger approaches, someone else swoops in, picks up the kid, and like takes them into an alley. And 9 times out of 10, nobody does anything. They just keep walking, and they kind of like, hope that wasn't bad, but it obviously was a bad situation. So I think the best message is that we need to be confident, and we need to, if we see something that's out of the ordinary, we need to either be prepared to take action or to at least notify the authorities quickly so that they can get the proper activation that they need.
Yeah. And this situational awareness, stay off your cell phone and just be kind of aware. Like even you may not need, like we're going to talk about protests and riots and stuff like that. But if you don't need to be there, don't put yourself in a situation. Like that's the easiest thing. Like we've seen stuff on social media and news, and I'm like, why were you there? Like, I get you're protesting and stuff like that, but like, if you don't put yourself in that bad situation, because it starts out as a nice civil protest, which you have every right to do, obviously, but then it kind of turns into that riot, and then mass demonstrations, and then things go bad. So don't put yourself in that situation if you can. That's the easiest way to get out of it, I feel like. But just being aware. And we talk to my kids all the time about, like, in your parking lot, don't be on your cell phone, things like that. And so if we're talking about protests and riots and just mass demonstrations, things we're seeing, even in New York, when they had the homemade bombs that they thankfully didn't go off. If you go a block over, things are fine. And like you said, you were traveling a good bit, and like where you were at, there was nothing going on, but we're watching the news and they're telling us that the city's burning down.
Mm-hmm. Well, I definitely think there's always a big difference between how the media portrays things and how it really is in real life, and things tend to be a lot more contained. But when you mention travel, I'll caveat this. We did an episode a while back about international travel, and I talked through some of the things there. And I would always say, anytime you're in another country, even more than in your own country, if you see a large politically charged gathering or a protest, go the other direction. Especially when you think about the fact that other countries don't have First Amendment rights like you might have here. So there is nothing illegal with them just shooting into the crowd to disperse it, or you don't really know what you're getting yourself into. So I have categorically avoided every single protest, every single gathering that I noticed happening spontaneously on a street anywhere in the world, with the exception of one time I was teaching classes in a hotel in the capital of Turkey, Ankara, and there was this very large plaza outside, and I got woken up one night in the middle of the night and looked out, and they were building a stage, and they had a massive political rally there the next day with over 100,000 people, and they were out surrounding the whole area. All around the hotel was crowds, and we just chose to not leave the hotel at all that day because there was just nowhere you could go to not be in the middle of this crowd. And I would recommend, if you're in the U.S., if you're abroad especially, and there's a large political gathering, unless you have a really important reason to be there, don't be there.
Yeah, that's good. All right, podcast over. Let's go, team.
Right, avoid it.
Go team. Number one rule: avoid it. But we see this, and obviously we're talking about medical here on this podcast. Is so when we start having these large demonstrations, these large crowds, it blocks access to EMS because we're driving big, especially here in America, we're driving big 450s, 350 ambulances, most of us. If you're in a Sprinter van, I apologize, but you're not able to get those big, large ambulances into the area. So we have to put all of our equipment on a stretcher that we think we're going to need, and we're going to put the stretcher and roll it across the sidewalks, whatever the streets, and probably not in the best health. So it takes us a little bit to get the stretcher out there and stuff like that. So these delays in medical care are going to be what the main thing we're going to think about as far as patient care wise.
Absolutely. Yeah. And I think this old adage of making sure the scene is safe for you is still important. I mean, these are inherently situations where the scenes are not typically safe, but as much as you can, make sure that you are safe before you try to lend any first aid or medical care to anybody else. Because if you end up becoming a victim as well, if you end up with a severe injury, you're not helping the person that you were trying to help. And now you're an added casualty that may get put to the front of the line in front of them, or exacerbate the situation for the person you were trying to help. So I would say make sure that whatever the violence or whatever the situation was that caused that, wait till that has passed and then enter and start rendering first aid. But always have, like you said before, have your head on a swivel, have situational awareness, don't get locked into one thing, and know what your limitations are as far as the treatment that you can provide, how quickly you can provide it, and in what context you can provide it.
Yeah, and thinking about, secondary hazards, secondary devices, stuff like that. So, you may have this protest where people are getting hurt. Maybe there is some secondary devices, explosive devices, chemical releases, stuff like that people are trying to catch those first responders coming in. So they're trying to catch people like that. So just, you have to be aware of, your personal safety situation, and just kind of, like you said, know what you're capable of and know your limits. And then your safety is always important. You can try to be helpful, but if I'm in a large crowd with my family, I'm going to get my family out first and get them to safety before I do anything. And if I'm by myself, then that's, I'll try to do what I can, but I have to know that my family comes first.
Yep, absolutely. And whenever we're talking about these situations, it can obviously be anything from, a protest in Minnesota to, someone throwing a device in New York, to maybe you're overseas listening to this. We probably don't have very many, Iranian followers or anything, but maybe there's some situations there that you're dealing with, or, anything, car driving into a crowd. There's so many things that can go wrong. Always remember that crowds are unpredictable, and there's always opportunity for crowds to become violent, even if they are not in trying to commit something violent, but just because of the panic that can arise when something traumatic happens. People are trying to get away. They don't know where the threat is coming from. There's always a risk that those things escalate very quickly, because emotions are going to be high and logic is going to be low. And that creates a very unpredictable situation. And then you have law enforcement rolling up. They've got potentially hundreds, thousands of people around. They don't know who the good guys are. They don't know who the bad guys are. They don't know who's helping and who's not. Not the time to be standing there with your personal sidearm drawn, looking around, And so think about law enforcement. Think about what their perception is going to be when they walk up to you. What noises, sensory issues are there going to be? And then again, like you said before, can the ambulance get there? Are you going to have to evacuate people out to a different location? So there's a lot of things that make these situations very difficult and chaotic.
And it's interesting too that there's psychology that says that, like, if we come in this exit, like our entrance A, and we're all on the other side of the building, our psyche says that we have to go back to that door. Like, we want to get to that door. That's where my car is. That's where my purse is. That's where my backpack is. What if I have to get to that? So you'll see these large crowds kind of moving towards that exit. Like, I think the food court, like everyone parks at the food court at the mall. Like, people still go to the mall, but they park there. So if there is something that happens at Belk's or JCPenney's on the other side, they still try to get that way back to the food court and get out of the building instead of just going out emergency door. Like, just get out of the building.
Yeah.
So thinking about that, when we're talking about these large crowds and you're talking about the moving, then you need to think about, like, if the crowd's going this way, like towards your left, then you need to go to the right, like get away from the crowd, because whether he's using a vehicle or a gun or a knife or explosive, he's looking for that crowd that you can get to. So getting away from the crowd, don't think about the herd mentality. Like our mom said, there's always, safety in numbers. But when something like this kicks off, safety is not numbers. Like, you do not want to be where all the numbers are at.
Right. And even if if the crowd is running from the threat, that doesn't necessarily mean going with the crowd is the best option either. Maybe going 90 degrees from where the crowd is. If the crowd is going west, I'm going to go north. I'm not necessarily going to go east toward the threat or west with them. I'm going to go in a different direction where I can take cover and find concealment.
Definitely. Just some of the things you talk about, when you do that, is you've got blocked intersections, blocked roads that you're trying to get away from. Maybe you took a wrong turn and now you're trying to get back. So you've got the roads are blocked. Communication is always important. So thinking about, like, your cell phones, because of the towers getting overloaded, you may not be able to make phone calls out. So a lot of times you can still send a text message when the tower gets overloaded. But a lot of times they just shut down. Like, you just have no bars, no service, because that particular cell phone tower now has too many connections to it. So you get a large crowd like that very easily could shut down communications. And then, like we were saying before, just delay in EMS, just trying to get into the crowd. We are overwhelmed and trying to get into there. We have limited resources. Your service probably has, a couple ambulances. It could have 50 ambulances, but if they're probably still running calls like normal too. So they have this protest, this demonstration, and then grandpa's still calling for chest pain that they have to run as well. So they're going to be overwhelmed and delayed, and then try to get the scene safe. We got to get law enforcement in there to secure it, and then we get patients in there and get them moved out.
Yes, absolutely. So if you are going to any large event, particularly if you think it might be politically charged, take some precautions. So first, obviously, we're going to recommend you have medical training, get some first aid training, get some hands-on training. We'll talk a little bit about what those injuries are that you might see, how you would treat them, what kind of gear you should be carrying on you. But also just general situational awareness is where are your exits? How can you get out if something happens in that area? Stay on the edge of the crowd instead of moving into the middle, and make sure that you're not boxed in or trapped where you are. You should not allow the flow of the crowd to push you into a place where the only way that you have to get out of that situation is to go back through the crowd and get out. So be very aware of your surroundings, always thinking about if something happens here, if this gets out of control, where am I going to go? How can I get out of here safely? So then let's assume something bad has happened and now there are injuries. Let's talk about the injuries you're likely to see and how you would treat them.
Yeah, so I think probably you're going to see a lot of blunt traumas. So we have two types of traumas, basically. We can go blunt trauma versus penetrating trauma. So blunt's going to be like you have a fall, you're getting pushed down, maybe somebody hits you with a baseball bat, somebody's throwing objects. Like that's going to be your blunt trauma. You could also have penetrating trauma, which is more typically, you're going to see like the stab wounds, gunshot wounds, stuff like that. So just thinking about blunt trauma for a minute, we're going to see people who are going to fall. They're going to trip. They're going to panic. Maybe they can get stepped on, things like that. So you're looking for fractures, some pain, swelling to extremities, and difficulty moving arms and legs. So just a good assessment there, a good trauma assessment. We've done several podcasts on that, like doing that head-to-toe exam and kind of seeing that DCAT BTLS. If going through that and kind of seeing what we can find, contusions, bruising, pain, whatever we see there, and kind of noting that so we can start treating the patient.
Yeah, absolutely. And we have a lot of past episodes that you can go to if you want to really deep dive into all of the different ways of treating blunt trauma. And I think we've talked about kind of revisiting some of those topics again here in the near future, if we run out of topics. But fortunately for us, the world keeps giving us lots of interesting things to talk about. So yeah, we might get around to that. But if you've got swelling, we want to ice it. We want to immobilize it. If you have a deformity that looks like a fracture, we want to try to splint that in place so it doesn't bounce around as the person is moving, and then move them to a place where they can get evacuated. Anytime you have symptoms of like a head injury, their confusion, loss of consciousness, we want to keep them in place, and then we want to prioritize that person for transport, because head injuries are a really time-sensitive injury.
Definitely. And unfortunately, there's not a lot we can do pre-hospital, even, the first responder, paramedic side on head injuries currently. So just we got to get them to the hospital. So anybody who's had a sudden loss of consciousness, they black out, they hit their head, they're unconscious, none of that. So that we need to treat that as serious as a head injury. And it's kind of interesting. Like I remember, like we used to downplay concussions, and now concussions have really kind of picked up, and we realized the danger of them, especially having multiple concussions, stuff like that. So they are serious. So if someone gets knocked out, they need a CT, they need to get looked at.
Absolutely.
And then with the blunt traumas, it can be kind of hard to see too, because the bruising sometimes can be late, as a late sign. So you're going to be palpating and feeling that pain, but people are often looking for bruising, but typically that's going to be blood pooling up under the skin. So there's a late sign of internal bleeding, things like that. So just going to have to trust your assessment skills, and with that palpating and feeling for pain. And but often those blunt traumas get missed. We see it at the hospital all the time, where our crews transport to our local hospital. They do a CT, they do a scan, and like, oh, they have a bleed. And now they're starting getting the bruise an hour later, and they get transferred out to, the trauma center. And we're like, we didn't see that. Like we felt it, but our crews didn't see any bruising. So that's generally a late sign. You're just kind of trusting the pain scale of the patient.
Yeah. And that's nothing against the providers, because it takes an ultrasound to find those bleeds until it gets closer to the surface of the skin where you can see that. And, in the abdomen, that can be a patient's entire blood supply can be lost into the abdomen pretty quickly. So definitely listen to the patient. If they're complaining of bleeding in a place that you can't really assess, like the stomach or the pelvis, or complaining of pain, in those places, you should have a high index of suspicion that there is bleeding internally that you can't see yet.
Yeah, we talked to our crews about trusting the vital signs. That tachycardic patient means they have a high heart rate, and you can't explain the high heart rate, like especially in trauma patients when you think about bleeding. Someone's super anxious. That's one of the first signs we see under shock is that they're just anxious. They're cool, pale, diaphoretic. They're pacing back and forth. So kind of trust your instincts to going, hey, they're sick. So uh, to kind of mention a little bit about penetrating trauma. So like lacerations could be something we see. People throwing bottles, throwing objects, things like that. They get cut, whether it be uh, projectiles of any sort versus debris, broken glass. They get kind of thrown. Now we're looking for external injuries, bleeding to the head, arms, and torso. For that bleeding, we got to be able to control. So obviously, we want to control that first with direct pressure. Get gauze, shirts, whatever you can, and put direct pressure. If it's a wound that we can compress, then that's what we're going to do. We're going to hold pressure. If it's a wound that we can't compress, like the abdomen, chest area, then that's internal bleeding that we can't do anything about. So we need to get them transported to the hospital super quick. And then if it's something we can compress in the arms and legs that we can't control with direct pressure, then we'd want to put a tourniquet on it.
And you just buy whatever tourniquet you want off of Amazon, right?
Yeah, just go to Amazon. Oh my gosh, I'm gonna have a headache. You could probably all of these supplies that we're gonna talk about. Probably there's a website. Maybe if you look at medicalgearoutfitters.com, and maybe if you use Civilian Medical, that would get you 10% off.
It's a good idea. There's, in all seriousness, there have been a number of videos that I've seen recently of. I saw one recently from the violence in Mexico after the assassination of the drug lord down there. And these guys were trying to tourniquet their friend, and they had like 3 broken tourniquets sitting on the ground, and they're trying to crank down the 4th one. And it's just like, you think you're saving money, but if it takes you 4 tourniquets to find one that doesn't break because you bought the cheap ones, it's not saving you any money. And it's certainly not worth it in that
Meanwhile,
moment.
your buddy's bleeding out 500, 600, 800,000 cc's of blood on the ground that we can't very easily replace. A lot of pre-hospital people are carrying blood, which is awesome, but that's still expensive and doesn't really is not widely available right now. So,
and then kind of the middle ground between the core of the body and the extremities are those junctional injuries, which you want to pack the wound and apply direct pressure to the packing. I think we have an earlier episode where we get into that in a little bit more detail. And on the Skinny Medic channel, you've got some great videos showing people how to do that. So I would recommend that. Those are, I think, the most complicated injuries because they're treatable, but they're not easily treatable, and you need to learn a little bit more about those. So I would say, instead of us discussing it more here, I would say go look at some Skinny Medic videos on YouTube, and you'll find some really good resources for treating those injuries.
Awesome. Appreciate that. The little plug there. So thinking about more like respiratory irritants, we talked about trauma versus blunt versus penetrating. So a lot of times law enforcement, things like that, they're going to use these irritants to kind of disperse crowds, whether you use tear gas, pepper spray, things like that. They're going to use it. They can they're handheld, they can throw them onto the ground, or they have like a 40 millimeter gun that kind of shoots it. And they could be an impact round, or they can go like onto the ground and disperse the gas. A couple different options for gas releases that sheriff's office has, police department, SWAT teams have. It could be something mild, or it could be something really nasty that's going to expose you there. So I've been gassed for the SWAT team, and it's not fun. But you're going to get you can't talk, by the way, like you just can't catch your breath. Your nose and ears, your eyes and nose start watering like crazy and burning. And you have a really hard time catching your breath. So you get that irritant too. Your skin starts to burning. But those are no joke, and you can't get away from it. Like you panic if you've never been exposed to something like that because you can't breathe. We were doing it in our shoot house, and one of our snipers, who's probably 6'3", 250, 260, like shoved me out of the way because he had a leak in his mask because we're all sitting there talking, and he had a leak. And he like shoves me out of the way and like I gotta get out of here. Gotta get out of here. And I was like, man, like you almost killed the medic just because you couldn't get out of the room. And so we were making fun of him, but that stuff's nasty. We had one that literally they were gassing this house, and we were like 2 houses down, and like we're still wearing our gas masks. Like we're carrying on a conversation, just shooting the breeze, but we're wearing our gas masks because we just couldn't stand the irritant that far away. But it's made to disperse the crowd, and they do a really good job of that. But you've got to wash your face. If you're touching your eyes, it makes it worse. Like if you start rubbing your eyes, and it just absolutely drives, it makes it worse. But actually, like Dawn dish detergent, that soap works really good, because typically what they're doing is an oil-based irritant. So the oil is just kind of sitting on your skin, sitting in your eyes, and like that. So if you use a dish detergent, dish soap, that breaks up the oil and kind of helps wash it away a little bit. So, but not fun.
No. So rule number one, if you're in that situation and there's a canister that comes toward you, don't pick it up and try to throw it back. Because you most likely don't have the expertise to differentiate between what is going to disperse tear gas or something like that versus a flashbang. And there is a very famous video going around of someone who picked up a flashbang and tried to throw it back. It is a less than lethal device, but it still can cause severe damage if you pick it up. And a lot of them may get hot when they're dispersing the gas as well. So rule number one, just move away. Don't pick it up and try to throw it back where it came from, throw it somewhere else. Move to fresh air immediately. Try to control the rate of breathing. A lot of times the pain is going to cause panic, like you said, and they're going to have a sensation of being short of breath. Most likely they're not actually short of breath, but they're going to have that sensation. So helping them to calm down, and then flushing the eyes with water, saline, and then if you have Dawn dish liquid available. If for some reason you know you're going to be in a situation where this could happen and you still choose to go there, I would bring some Dawn dish detergent, have it in your bag, along with some very clean water, bottled water, or saline if you have it available to you. If you have backup change of clothes as well, in case your clothes get contaminated with something, to be able to change it out without having to run around the rest of the protest naked, that would also be a really good step to do.
It definitely settles on your clothes too. At least the stuff we've messed with. Like we do it, like we're like, all right, cool. We take our mask off and walk around, and you go to lunch, and like something happens, like you smell like, oh god, I smell awful. Like it just stays in your clothes. But yeah, so it can happen.
Sure, if you have respiratory problems or asthma, and you start having any breathing difficulties with that, that's where you need to really look to get access to EMS and get some professional help. Get to the hospital, call 911. You might have to find your way to the edge of the crowd to a safe place to call 911 and get that ambulance there. But that would be another reason I would avoid situations like that as an asthmatic myself, that I don't want to get tear gassed and cause my asthma to flare up.
Definitely. And one of the things I think about is like the heat, humidity on these things. That hits home for me. My small city hosted Trump when he was doing his run for the presidency. We are a small city, small town, and he wanted to come to a small town. We had probably like, I can't remember the number right offhand, but probably like 20,000 people on Main Street. And if the temperature had been 10 degrees less, we would probably not have had any patients. But the temperature was 10 degrees higher with about 100% humidity. And so we treated about 400 patients in 12 hours with the help of my EMS service, and the hospital system was helping us. But we treated about 400 patients for dehydration and heat emergencies. We ended up having a cardiac arrest on Main Street in the middle of the rally. She survived. But that drives home, because I'm like, man, if we would have been 10 degrees cooler, we would have been sitting around drinking coffee all day and thought we way overestimated what we thought was going to happen. And instead we were drowning with patients, and full MCI. I ended up getting into an argument with one of the Secret Service guys, I did not get a coin out of it. But I was setting up a casualty collection point like off of Main Street, because these people were just pouring out. Like people are semi-conscious, and their friends just dragging them off, dumping them off on this curb. So we created a little casualty collection point right there off Main Street, and the Secret Service guy was like, you can't do that. I was like, I can do that. I'm going to do this. And he was like, I can't secure this little area. I was like, you have a gun, secure it for me. Like, this is what's going to happen. But I think about that. So think about what kind of clothes you're going to wear. Like, you don't want like black clothing. You want the lighter, loose clothing. Think about being hydrated, things like that, and just bring lots of water.
Mm-hmm. With electrolytes, because you'll be sweating a lot.
Yes. And then you can get those from EC Sports. We'll just kind of slide them in there.
Yep.
I like
code is Dietrich 15 for 15% off. I just ordered some more recently. We've gotten my whole family has gotten big into electrolytes recently. So my wife's training for a triathlon, and the boys and I do jujitsu and they do soccer. We've been big on the watermelon flavor because it's like for hot weather.
Yep.
All that hits. Little salt, watermelon.
We just ordered from EC Sports, and Kenneth was going to try the Pina Colada, but they were out of stock on it. So they said it's to be in stock about a week or two. So time you see this, but we're trying. We like the watermelon, and then now we're doing lemon lime, I think. So
I had both of those, the Pina Colada and the lemon lime, and they're all good. But the watermelon this time of year, as it's getting hotter, it's really, really good.
Perfect. So EC Sports. So when we think about we haven't been hydrated enough, what are some of the symptoms we can kind of think about for dehydration?
Well, obviously you expect to have, dry mouth, some muscle cramps, especially if you don't have the electrolytes you need. You'll feel nausea. Initially, you'll have heavy sweating, and then later on, as you get more dehydrated, your sweat will dry up because you just won't have the fluid to support it. And as you progress, you'll see increasing dizziness and weakness and headaches, as well as just general exhaustion as you get more and more severe into moving from like a dehydration to like a heat stroke type of situation.
Yeah, those patients present just like a stroke until you cool them off. So an ice bath can be helpful. But the first thing we'd want to do is just kind of move them to shade, get them directly out of the sun. Let's get them into a shaded area, maybe just under a tree, things like that. Get them to start drinking water, electrolytes like we talked about. And then, taking some of their clothes off a little bit, making it loose, and just wetting. You can actually wet them down to kind of help with that cooling off process. And obviously, if you've got an ice bath, we set those up, and you can dunk people in them and cool them off very quickly, which is something fairly new to pre-hospital EMS, things like that, is those ice baths. So cooling them off very quickly. But, that heat stroke is definitely concerning. So if they start acting confused, their skin is super dry now, but they've stopped sweating, or they're having seizures, then we're going to be super concerned and definitely need to be treated as a medical emergency.
Absolutely. Yeah. Especially when you start to get to those signs, you're pretty late in that heat stroke continuum, and you need to get help immediately.
Definitely.
Yeah. So the problem with these situations is that there's really high stress. There tends to be really high emotions, and that can lead to psychological reactions like panic attacks, hyperventilation, anxiety, disorientation. And the problem with all of those things is they have a lot of symptoms that mimic other medical symptoms as well, and it can be hard to differentiate. So we look at people that are breathing really rapidly, they're shaking, crying, perhaps the feeling of the crowd around them is giving them a feeling that they're unable to escape, that they're boxed in. You can start by moving the person to a quieter place, get them away from the action, speak calmly, and see if that helps to calm them down. If they continue to complain about things like chest pain or shortness of breath, they definitely need to be referred to the EMS system by calling 911 or getting them to a tent or something if there's one nearby. But encouraging them to breathe slowly, speaking very calmly, and trying to get them outside of that chaotic environment can help you to differentiate whether this is a psychological stress reaction or a medical emergency that needs to be treated right away.
That's one of the worst calls I hate running is a hyperventilating female. Like, I'll just say it. Like, that's the most unpolitical thing I'll say. But yeah, that is a hyperventilating woman call. Like, I would rather run someone who's got pee on them or vomiting than a hyperventilating woman, because I'm like, you have to fix it. Like, you have to fix yourself. Stop hyperventilating. Stop crying. Like, fix it. Like, I can't do it. Like, here's some Ativan. Like, stop.
You got the Ativan. You can fix it.
Yeah, I can fix it. Like, here's some Versed. Here's some Ativan. Here's some ketamine. Whatever you need. Just stop hyperventilating on me. But yeah, that's one of the worst calls. Like, that's like when people talk about like, what's the worst call you ever ran? It's a hyperventilating 19-year-old kid that I can't get to stop hyperventilating, and now I have to start an IV on this chick and give her medicine. I'm like, you're making me breathe fast. Like, stop. So yes, definitely.
That feeling, the feeling of panic that comes with hypoxia is so deep ingrained in us that it's so hard to calm down when you're convinced that you're not getting enough air, but the actual problem is that you are breathing too fast. It's a great response and it's there for a reason, because if you are not breathing, your brain needs you to breathe or else you're going to die. But when we trick our body into thinking that we're not getting enough air and our brain thinks that we're not getting that oxygen, it's a really difficult thing to calm someone down from that, because they're in a legit panic. But it takes them finding a quiet space in their mind to calm down, or a sufficient dose of Ativan to be able to calm them down enough to where their brain stops overreacting to perceived hypoxia.
Yeah, and I've had several patients who've collapsed, who've went unconscious for a brief period and come back. Now their brains, like you said, they think they're hypoxic. Now they've had a syncopal episode, they've passed out, and now they're really freaking out because they've passed out. And I'm like, all right, stop. Here's some Ativan. Like, here's some first aid. So, but yeah, that's one of my worst calls. Like, I do not like hyperventilating women.
Well, so when we look at these medical emergencies, so we have blunt trauma, we have penetrating trauma, we have potential explosions, chemicals, psychological emergencies. These are all the same injury profiles that we talk about all the time, just in a different context of having all this chaos around you. So if you already struggle with, keeping your mind calm in any emergency, having this happen when there's 5,000 people around you panicking is going to exacerbate it. But ultimately, the injuries that we're talking about are the same injuries that we talk about on every episode of this podcast, every time we talk about DCAT BTLS. So, get medical training.
Stands for?
Get the right. Sorry?
Do you remember what DCAT BTLS stands for?
Of course I do. Deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling.
I'm proud of you.
So get the right training, have the right equipment. We'll talk about the equipment next. Because if you're prepared for all of these common traumatic emergencies, you'll be prepared for the ones that happen in the event of a situation like this. So I will pitch this to the medical gear person to talk about what you should have if you choose to go to something that you think may be an event that could cause some problems related to civil unrest, a politically charged, emotionally charged event. What would you be carrying with you?
So I think one of the things is what kind of bag we're going to put this in. So you need some kind of bag, whether it be backpack, satchel, like sling bag, something that you could put these supplies in, because you're probably not able to put them all in your pocket, like your BDU pocket or your blue jeans, things like that. So we talk about BSI Scene Safe. So some gloves would be super helpful, especially if they have used some kind of irritant or gas that may be on objects and like that. So having gloves that you can put on. If there are bleeding, then you may not know this is a bystander. So gloves is always a good idea to have. And then gauze and a pressure bandage is going to be something kind of think about, even those minor bleeding, the minor boo-boos, all the way up to, oh my gosh, that's a lot of blood. So having the gauze, a pressure bandage, and a tourniquet is going to be helpful. I would probably have at least one tourniquet, if not two tourniquets on me, just because we know that sometimes the legs, we may need two tourniquets, but you can use a lot of gauze there as well. We talked about some saline and eye irritants, using saline or water to kind of flush those out. And you're going to need a good bit of saline and water to flush those out. We're not talking about just a few cc's. We're probably talking, a large amount of fluid to kind of get all that stuff flushed out. An airway, like a CPR mask, if someone does kind of go into cardiac arrest, and we want to do mouth to mouth is gross, so we don't really do that anymore. So there's a CPR mask. We talked about electrolyte packets. You can use like the East Sports, like we talked about our company that we like to use. Put it in a Ziploc bag and you can carry it, or you got like Liquid IV has little packets, things like that. And just a small flashlight or headlamp, I think is useful. A flashlight is obviously useful for everyday carry, but I like a headlamp, honestly. Like I like this because I talk with my hands a lot. So if I start talking and working with my hands, I'm not going to hold a flashlight. So I like that. Some other things you could think about would be chest seals. Now, there's some new data coming out about chest seals that they probably don't need those as much as we thought we did. But they're all obviously something we can think about. The torso, abdominal area is going to take up a large surface of our body surface. So if there is projectiles coming, you're more likely probably to get hit in the chest, abdomen, back area, and you're not going to have unless you have a vest on, which maybe you could do that. Trauma shears, I like the egg shears for this because they're super sharp. They cut through. I like my egg shears. I've kind of moved away from that, the Raptors, and now just carrying egg shears in all my kits and things like that. A space blanket, thinking about that March algorithm. Once we get through all the MAR, C, and then we're into H. So heat loss prevention, the hypothermia. Even it's 60 degrees outside, someone can get hypothermic very quickly on that. And then eye protection, safety glasses and all that, so we don't want stuff flying up into our face. And then basic medications, I'm thinking like Benadryl for allergic reactions, Tylenol, ibuprofen, some basic pain meds you could think about, Imodium for stomach issues, and just some good general over-the-counter medicines, probably a good idea to have on you as well.
Yeah, I agree.
Yeah, I think
I would just clarify, you said a large amount of saline. I would quantify that as between 500 milliliters and a liter.
Yeah.
Probably a good amount to carry on you of water or saline for flushing. It takes a lot more than, you don't want just a little bottle of water. You want 500 milliliters to a liter would probably be a good amount.
Perfect. Yeah, I was thinking like you don't want like the little sometimes you see them on Amazon, like little capsules that have like 10 cc's, maybe 5 cc's of saline in there. You're gonna need those are for eye drops, like when you have your contacts are dry. No, we need to flush it out. And then in EMS, we actually take the nasal cannula that you put oxygen in, and you can connect it to a 1,000 cc bag and let it flush out. It's uncomfortable for the patient, but we definitely have something we need to do that with.
Yep. I've used that for a patient that got pepper sprayed in the face one time by a rookie police officer who didn't understand air movement. It was a very windy day, and so all of us got pepper sprayed that day.
Stop. I actually did it fairly recently to a lady who was at a gas pump, and gas flew up in I don't know how she did it, but gas flew up in her eye, and so it was burning. We had to because the gas thing's burning her face, her skin. It's also burning her eyes. So we had to get it flushed out pretty good, and we had to flush her whole face because the gas thing was burning her face. But that was fairly recent, so I felt pretty cool. Apparently they don't teach that skill anymore about the nasal cannula, or at least not in this paramedics class. So I started working like a Lego set, trying to get this thing connected. And the paramedic on the truck was like, "What are you doing?" I was like, "We're going to flush her eyes out." And he's like, "With a nasal cannula?" I was like, "Yeah." And I started building this, set of Legos in the back of the truck, and they were like, "That's cool." I was like, "See, I come out looking like a hero for knowing one little piece there."
Yeah. Old school tricks.
Yes. Sometimes they still work.
Yeah. So speaking of law enforcement, we can segue into that a little bit. We mentioned it earlier, but anytime there's a situation like this, there's going to end up being, if there isn't already a large law enforcement presence, there's going to be a large law enforcement presence at some point around this. If you're trying to provide care, you should identify yourself as soon as you're approached by a police officer, or if you're trying to approach someone that needs care and there's a police officer in the vicinity. Make it clear that you're trying to provide medical care to this person and that you're not engaging in any type of hostile action against law enforcement. Follow their lawful orders and don't interfere with police operations. Don't want to get political here or anything, but this goes back to your own safety. If the police are operating somewhere, they're already going to be on edge because there's a lot of people around. If they give you an order to go somewhere else, go somewhere else. If you can take some patients with you and treat them somewhere else, do that. And know when to disengage. If things get unsafe while you're in the middle of treating somebody and you can't take them with you, leave and come back. It's better for them that you leave and come back than if you both get injured. Or if the police order you to leave. And be aware that EMS may be activated right away, but they may not arrive right away because they may be staging somewhere offsite until police say that the scene is secure. As paramedics, we don't go running into everything. We don't run into anything. We walk into places when it is safe for us to be there. Because again, it doesn't help our patient if we get injured. So it might seem selfish that the paramedics hang out 100 yards down the road until it's safe for them to enter. but over and over again, it's proven to be much better for the patients and obviously for the paramedics if they wait until the police have secured the scene. So don't be super surprised if it takes a while for EMS to get there. You may be providing that care for longer than you normally would in that particular area.
Yeah, I told my son, my son's started driving this last couple of years, and my daughter's going to start driving very soon. I've like whatever the officer tells you on the side of the road, like you follow his or her commands. If they're wrong, we'll take them to court. But you're not gonna win an argument on the side of the road, whatever this be an environment. You're not gonna win. They're going to win. So just comply. And if the officer is wrong in the law or whatever, we will take them to court. We'll name them, the department, and everyone else, and we'll go on a nice vacation. But on the side of the road, you're not going to win. So you're right. Just if they come up and they're hyper active, they're on edge, then we're going to comply with them. And if something happens, we can talk about it afterwards. But that kind of goes into, like you've said several times, that our safety is number one. So if the scene is not safe, then we don't need to be trying to do patient care. Like, right. I understand that you have tear gas in your eyes, but they're actively brawling right beside us. Like, I'm not going to do that. We're going to leave the scene. So thinking about that, if the crowd is moving and we're going to get crushed because I'm kneeled down with your boo-boo, I'm not taking care of your boo-boo. We're going to move. And just kind of being that presence of, they're warning us that they're going to spray chemicals. They're going to do flashbangs or whatever else. Like, we're not doing patient care. We're going to move. And that's something we have to think about as ourselves. Unfortunately, no one loves me as much as I love myself. So we do have to kind of think about that. Yeah.
I think when you think about situations outside of your training as well, it's important to make sure that if you get something that you can't handle, that you don't bog down the system by trying to help that person. You find the resources that they need. Don't make the situation worse. You hear Dietrich and I, who are both trained paramedics, saying, here's some situations where we're not treating somebody. There's active, people are actively fighting right here near us, or they're shooting, or there's something else, or the crowd is moving toward us. We're not going to actively treat a patient. So if I think most of our listeners are civilians, probably, who are interested in medical care. So I would say that goes even more for you to make sure that you keep yourself safe so that you don't become another casualty. I know we've said that about 5 or 6 times already, but I want to repeat that because it does not help if you multiply the number of patients through trying to help. But if you do have the opportunity to help in a safe way, would strongly encourage you to stick to the basics of what stick to the things that we've discussed, how to approach patients with the March algorithm, how to treat patients, particularly with bleeding and life-threatening illnesses, and you can make a significant difference. And I would encourage you to do that.
Definitely. Just a very simple, we're not talking about a whole lot of money and supplies, and we're talking about, a few hours of basic first aid training that you could learn in a CPR class, stuff like that. A Stop the Bleed class, typically those are free classes. You can find those at bleedingcontrol.org. And you could save a life. Like, you absolutely could make a difference and save someone's life. Someone's having a bad day and you can make a difference. But being prepared is what you need to think about. Like, you've got to have a mindset, a game plan going into, like, if someone gets hurt, this is what I'm going to do. And that comes with training and that mentality, that mindset, you're going to step up and help someone.
Absolutely. All right. Great talk. Good stuff.
Awesome.
Yeah.
Cool. Anything else you want to add?
See you all back in April.
Yeah. Perfect. We'll figure out what we're going to do. I have no idea what we're going to talk about. We'll find something, I'm sure.
Yeah. Something will happen between now and April that we can talk about.
True story.
Find us and subscribe at civmedical.com.